Well, hello everyone. Thank you so much for joining us to another episode of On a Bridge MD. I'm Dr. Isabelle Amig, your friendly rheumatology and host of the podcast. Today we have Dr. Soyona Rafatjah that's coming to talk to us about functional medicine. She has a very successful practice in Denver, and without further ado, I'm going to bring her into the show and we're going to learn about functional medicine. Dr. Rafatjah, thank you so much for being here. How did you? Yeah, thank you. How did you learn? How did you get into functional medicine?
Yeah, I'll keep it short. There's always a roundabout way, right? But I found functional medicine pretty early in my career. I was so grateful to have kind of like the crumbs placed in the right places, and my path really led me to where I'm at right now. And basically, I did my undergrad in biomedical engineering, and that was something that I chose like halfway through. I didn't really know going into college what I wanted to study, but art and science were both always like on my mind. And then from there, half those people were going into medicine. And so that kind of piqued my interest of like, oh, wow, like, could I be a doctor? Something I always thought was so admirable, like growing up. Like anytime I was sick, I would go to the doctor and they would give me like an antibiotic or, give me some advice or whatever medicine that made me feel better. And it was always so incredible to watch that happening. But so at that point, I was like, wow, like I had the confidence to actually pursue something like that. And I took a year off, after college, and I had an interest in mental health initially. Psychiatry was something that I was thinking about early on. I just thought I still think the mind is incredible. And I think actually psychiatry with psychedelic medicine coming in now, I think it's actually exploding into this really incredible discipline. But I think back then, more than 20 years ago, it was still just kind of medication and pharmaceutical drugs. And I didn't love that idea. Mm-hmm. So I spent a kind of a 9-month period before medical school, like kind of diving deep in this behavioral health program, seeing these really severely mentally ill people like schizophrenia, bipolar disorder with hallucinations, really like people who are on Social Security and can't work. We're in this day program, and we would come and they would come and we would do these different things and educate them on nutrition and exercise and kind of like a holistic integrative approach. And they were social workers that were, leading me there. And what I saw was that, these things were so important, meditation and movement and getting outside and going to the park. Like I noticed these things were the powerful things that helped them feel better. And yet their medical doctors were only prescribing these drugs, and they were having all these side effects. Like, antipsychotics are very important for people to function, but they cause metabolic syndrome, they cause obesity, they cause high blood pressure and diabetes and like all these terrible things. And they were not being looked at as a whole. They were just being given these drugs by their doctors. So that kind of turned me off to the field of psychiatry initially, and turned me on to the idea of like, there's so much more to healing someone than a medication. There's so many aspects of lifestyle and mind, body, and all of this that needs to be paid attention to. So when I was applying to medical school, I really wanted to go somewhere that had an integrative medicine program specifically. And back then, again, like more than 20 years ago, like around 20 years ago, it was rare. People didn't really respect integrative medicine or didn't even know what it was, to be honest. And so they were just like, this is weird, like whatever, just dismissive kind of. But I really had an interest early on. So I went to University of Miami in Florida, and I had some incredible mentors at the department there for integrative medicine. And during my whole medical training for 7 years, going into family medicine residency, I stayed in Miami. And they had all these programs where I could learn clinical nutrition and functional medicine concepts. So I learned about why it's important to check vitamin levels. Why is vitamin D, for instance, why is that important? Why are people deficient? What is magnesium? What are, omega-3s, and what does that do? And, what is the gut flora and microbiome? And, again, back then, no one was talking about the microbiome. Like that was still kind of like, what are you talking, what is that? People were, it was still so new, but I had this incredible opportunity with these mentors down there that were on the cutting edge really of integrative medicine. So thankfully I had that education concurrently with my conventional training. So I never really got quote unquote brainwashed by the system and had to kind of like do a lot of unlearning, which is what a lot of MDs and DOs that go to conventional training have to do if they want to get into this field later, kind of. So I was really lucky in that sense. So the first job that I got was in integrative medicine, and I just kind of went from there. And here we are, Prime Health. We started this about 6 years ago in Denver, and yeah, and now the field is really exploding. It's really exciting. It's really catching on. People are fed up with the conventional medical system. They don't want band-aids anymore. People really want the root cause and really address the underlying issues and for long-lasting health.
And so can you maybe explain a little bit the difference? Because some people ask me, and I try, but I'm not in the field of integrative, right? I'm a holistic because I look at the patient as a whole, but that's different than integrative or functional. What are the different terms? Like how can you explain them a little bit to our auditors?
Yeah, definitely. Integrative medicine is more of a broad term of like, we accept all forms of healing.
Oh, I love that.
Like integrative means like we will, we understand and respect, like Chinese traditional medicine. Like we, understand that there's a place for Reiki. We understand that there's a place for mind, body, and meditation, and even maybe psychedelic medicine, which I alluded to before. And, there's a place for yoga and strength training, and like literally like everything that you can do for your health can be considered something integrative. And even like homeopathy and like different types of healing like that, chiropractic, all of those, like everyone working together, collaborating for the purpose of helping someone heal. That's a true integrative approach. And that can include functional medicine too. So then functional medicine is like is a little bit more specific. It's like a specific field where we're looking at the body in a systems biology approach. So meaning every system in the body, every organ system is interconnected, and we know that. And so we're looking at it as a whole, as opposed to siloing, like, okay, gastroenterology takes care of your digestive system, and psychiatry takes care of your brain, and neurology takes care of your nerves, and just kind of like the way that conventional medicine is so siloed, and it's almost as though your organs don't talk to each other or they're not connected, which is mind-blowing. So functional medicine puts it together, and basically we can boil it down to, there are certain areas that are going to affect every single system. Like, so we have to look at, toxins. We have to look at inflammation, and that could be, inflammation caused by so many different factors, that are affecting all the different systems. We have to look at nutrition and vitamins and gut health, and what's your environment like, mental, emotional, spiritual, and putting all of that together in a systems biology approach. So that's kind of the functional medicine piece. And that's where like a lot of the heavy, really in-depth investigative testing comes in, which is, super fun that we do, Prime Health. And that's where we can really nerd out and get into the weeds of stuff, and, coming up with, creative ways of healing.
I love it. And so, I like on this podcast to talk about history of hope, right? Because it's hope driven by science. That's the motto. And I really believe in this motto so much. Do you have a history? I was thinking of what are the ideal patients, but it sounds like everyone is a potential ideal patient for you. So can you maybe share with us a history of hope, since you have so many? I share some patients with you and we do really well, right? Tell me, like, can you tell us some stories? Just like maybe we start with one, and
Yeah, absolutely. I mean, there's definitely, like you said, everyone can use this approach, because whether you're trying to heal a chronic disease or, you're trying to just optimize yourself so that you live a long, healthy life, we can pretty much see anybody in this approach. And, it's called functional medicine, but it really should just be the way that medicine is practiced, period. But yeah, I mean, for example, something that functional medicine really excels at is gut health. And that is something that we always say, it's like a motto in functional medicine, is like, start with the gut. And that's not even just, it's not a new concept. Like traditional Chinese medicine has been saying that for thousands of years. They always, they knew that the gut was where health began or started to dissemble. And that's because the gut is where we share the environment, our internal environment, with the external environment. We take things from outside, we put them inside of our mouth, and it goes into our body and it assimilates, into our body, or gets, eliminated. But that interface between the external environment and our internal environment happens in the gut. So that's why it's so important. If there's any inflammation, or if that tiny, like thin, one cell thick, lining of our gut is disturbed in any way, that interaction between the external and internal environment is compromised. And then we're not going to be able to absorb things properly. We're not going to be able to get rid of things properly. So that's kind of in a nutshell why the gut is so important, because it is literally our interface, with the world. And so many people have problems with their gut for a multitude of reasons right now. In our modern world, we have, for instance, our food. Many people are catching on right now that like processed food is terrible for us. I mean, sure, sometimes we can have like a healthy, maybe organic packaged food, and that's fine, like clean once in a while. But like, the majority of the food that people consume now in the United States is processed. Like it's not a whole food. It's not recognizable to like nature. It's like adulterated, and it has chemicals and unknown substances and way too many like omega-6 fats, like, soy and corn and vegetable oils and things that our body is like, what is that? Like it's just confused. And so it's reacting in a negative way, like causing inflammation. So food is a big one. The chemicals that we're exposed to, not only through food, but through, like food through pesticides, because a lot of things are sprayed. And then through like heavy metals that we're exposed to, mold toxins, all of these different chemicals that we ingest and are exposed to, that's causing inflammation in the gut lining. Stress, is a big factor. Like the amount of stress that people are exposed to on a daily basis is not normal. It's not like what humans were, normally, accustomed to, like for millions and millions of years. We didn't have this kind of like chronic stress, or like staring at a computer screen all day, like, blue light and all this like artificial world that we live in. So it's like all of these different things are affecting us, and it does affect your gut. The lining of your gut will open, and it causes intestinal permeability, which, as you know, as a rheumatologist, that intestinal permeability can then lead to this autoimmune type reaction, because it's like then it causes the systemic inflammation. So it's really interesting. Like we see so many people with all these gut disturbances. Not only that, antibiotics are disturbing our microbiome, pesticides are disturbing our microbiome. Like everyone's like, why is yeast so prevalent? Why do so many people have candida? Well, put together an antibiotic where you're destroying good bacteria, and then a diet high in simple refined carbohydrates and starches. That is literally the perfect combination for the growth of fungal and yeast species like candida and things like that. And how many of us have had an antibiotic at least once in our lives? Not multiple times, like at least once a year. This is like, could be quote unquote normal for Americans, to be exposed to. And so the potential for your microbiome to be disturbed is massive. So we're seeing all kinds of people with candida, IBS, like undiagnosed, kind of like a washout, unsure what to do with you type diagnosis of IBS. And like, here's a medicine, it may or may not help, and that's it kind of situation. People with chronic bloating, chronic constipation or diarrhea, just all these chronic symptoms that are so like mild enough that they're not like gonna, die anytime soon. But it's like that type of a mild symptom is telling you something is very wrong. Like, this is not normal. Like, we're supposed to have regular normal bowel movements every day. Having gas and bloating and discomfort after every meal is not normal. All of those things. So that is like a patient, like a very typical patient that we see, and we love it because we love to be able to help someone with their gut. And there's so many tools that we use as functional medicine providers that can help. So anywhere from like nutrients that heal the leaky gut. We, of course, we do in-depth testing first to see what exactly is going on. Like, are you lacking pancreatic enzymes? Do we need to use some herbs to clear out microbes that are inflammatory, like yeast or parasites or inflammatory bacteria? And then
how, I'm so sorry, because I mean, again, I'm not trained in this realm, but how? I mean, we know that we have 1 billion bacteria, parasites, and things like.
Oh yeah,
we live a microbiome, right? So we know that we live happily ever after with this microbiome of ours. And how are you trying? Like, how are we getting rid? Like, how did we decide? I guess, like from a research perspective, how did we decide? Okay, this one is wrong, this one is right, and then how do we get rid of it? And just from a rheumatology standpoint, I would say that there's a ton of research going on in the microbiome realm. First, it was with spondyloarthropathy, so ankylosing spondylitis, psoriatic arthritis. But we also think that we also are doing research in rheumatoid arthritis. I don't know that there is on lupus, but I'm sure it's ongoing. So there's definitely a huge link between the two. And I just wonder, how do you like what was done to decide, okay, this parasite is not good, even though for like, I would assume that the usual test that we get patients that comes back from tropical country and has diarrhea, you do ova and parasite testing on the stool. That's not what you're talking about, correct?
No, it does include that. Yes. But we do also PCR DNA analysis too, which is a little sensitive for sure. But yeah, I mean, so there's all kinds of research. I mean, there's probably hundreds of papers coming out every day, on the microbiome. It's like at that level now, which is so cool. Yeah. But I mean, they're using even artificial intelligence now to like tell you, to look at your microbiome and then like extrapolate, like, okay, now that we have your microbiome analysis, we can extrapolate that you're more at risk for metabolic syndrome or IBD or so like, I mean, it's beyond me, like how they have done this, but it's to the point where, yeah, like even AI is being used to analyze the microbiome, which is super cool. And it takes that level of computer intelligence because, I mean, like there's trillions of gut, so.
And when you're seeing a patient, what are the testing that you do from a parasite standpoint? So you said that, yes, I'm doing the ova and parasite, so that's, but what other tests do you do? So, and then how do you get rid of those, since really we're talking about not trying to give antibiotics or give antifungal?
Yeah. I mean, we definitely don't want to use antibiotics unless we absolutely have to. Of course, I still have patients that write me sometimes, like, I have a sinus infection. Like, what can you do? So we just have to try to repair, it's not like we don't use them, but, in terms of parasites, yeah, they can be really hard to identify. So we do use tests that include like the PCR analysis, which can be very helpful. So we catch things on there that won't be caught on the O and P over a parasite. And then we can go a step further. There's actually this really interesting lab in Colorado. I used to use it even when I practiced in New York, but it's called Para-Wellness Research. And this Dr. D'Angelo there is the microbiologist who started the lab. And I think he's got a whole team now of people, but basically what they do, instead of looking at an ova and parasite slide, like one slide from a sample for like 30 seconds, which is like the standard at most labs, they will spend like 30 minutes like going through a sample, a stool sample, like really checking in depth, like all the different areas of the sample. I mean, it sounds crazy, but this is what they do there. So if I have a patient, I have a high suspicion of a parasite, I can't seem to detect anything on the normal test, I'll usually go to that one because he will without a doubt find something.
That's so cool. And so then, as you mentioned, you say, I try not to do parasite treatment. So you have herbs and you have supplements. Is that how it works?
Yeah, no, I mean, we'll use anti-parasitic medications too, for sure. You know, I mean, some people tolerate them just fine. It also kind of depends on the sensitivity of that patient, right? Because some people are so sensitive, then you have to use like tiny doses of herbs, you know, as a kind of, you know, to try titrate up, you know, eventually. But some people have a really strong constitution. They might be able to handle, you know, like tinidazole or, you know, Alinea or something like a little bit stronger. And that can work wonders. So using anti-parasitic medications, it's totally fine. It just depends on the person and their ability to kind of detox. And we always, you know, pair it with things like binders and other supportive measures so that, you know, when they do kill off parasites, they are also making sure we're getting it out of the body. Because one of the things that, you know, we have seen is that parasites can live in your liver, right? In your liver and your gallbladder, and they just keep kind of circulating through the bile system. And so we have to give them things that are going to release that, like TUDCA can be helpful in getting the bile flowing, and binders, like things like charcoal, clay, you know, those things actually bind to the toxins and the parasites and actually help them release from the body.
You know, it's fascinating. As I'm listening to you, I'm thinking this is so interesting because so I've done a little bit of infectious disease, tropical disease. When I was in France, I was really interested in that and went to some countries where there is parasite and you have to give patient, I think it's like once a year, they have to get like some sort of anti-parasites because the water has parasite or the way they handle food. And it's fascinating because I'm thinking this has been an issue all along. We've always had issues with parasites and it's just not something that we learn so much anymore. Like we learn about parasites and foodborne. I almost want to say foodborne disease, right? Infectious disease. In our study, like in our medical study, we learn about this from an infectious disease standpoint from tropical disease, right? It's something that you're going to get with your traveling outside the country. And what you're saying is that we are having this even here.
Yeah. I mean, it could be something domestic. It could be something that someone caught somewhere internationally, you know, people travel a lot.
Yeah, they do.
So, you know, and our microbiomes now, the way that our immune systems are in the modern world, like all those things I described that are constantly like berating us, like all the toxins and the things, and, you know, our immune systems are not great, right? So like maybe humans many years ago were able to handle like living symbiotically with certain parasites, but not anymore, you know, because our guts are so fragile and they're already compromised, you know. But there's a fascinating book actually, if you want to go down a rabbit hole on like helminth therapy. It's so fascinating. It's called An Epidemic of Absence, and it's all about a man who does so much research on parasites and how populations that live among parasites symbiotically do not get autoimmune conditions.
Oh yeah, and there's some things like that in like if you go to Mexico, I think there's always been parasite, like almost like if you have parasites, you won't develop or you can treat RA. The studies are not
Yes.
great, but there are, she's not a patient, but I have a friend, she's not really a friend, but someone that I know, that went to South America and treated her psoriatic arthritis, at least for a certain amount of time. And I thought that was really, really cool. And I think it's a helmet.
Yes.
And the studies are not great because I started looking at it. There was some article in the New York Times several years ago now. I just find it fascinating. Again, something that, we're looking at. That's why I've been talking about parasites with you. But I'm seeing the time is flying. I'm learning so much personally, but where can we find you? Where can our auditors find you if they want to learn more about you and about what you do?
Yeah, the best place is our website, primehealthdenver.com. And if anyone's interested in working with us in the state of Colorado, you can book a phone call and a free phone call and learn about what we do and how we operate and how we can help you. And Instagram is at Prime Health Denver. Those are probably the two, best places to reach us and to learn more about us. And we have a huge blog with a lot of information too, so you can just learn from that too if you're not in the state of Colorado and can't work with us necessarily.
That's wonderful. Well, thank you so much. It's been such a pleasure getting to learn about what you do. So thank you very much for coming on the show, and I hope we see you again. Have a wonderful
day. You're welcome. Yeah, looking forward to seeing you soon, Isabel.
Yeah, same. Take care. And everyone, if you enjoyed this episode or any other episode, please share it. The more you share, the more we can actually show to the world, and the more I can get some really interesting people here, and so we learn more all together. Have a wonderful day. We'll see you next week. Take care, everyone.